Good afternoon, everyone, and thanks for joining us for this Healthline 3. This is where we like to focus on ways that you can improve your life and the lives of those that you care about, and we start by improving our health. I'm joined now by a very special guest, and we're going to be focusing over the next half hour on radiation oncology. You can ask questions directly of Dr. Rosen, and by calling the phone number that you're going to see on the bottom of your screen. It's 318-219-4569. And joining me, as I said, is Dr. Lane Rosen, and he is a radiation oncologist and the medical director of Willis Knighton Radiation Oncology in Shreveport. Welcome, Dr. Rosen.
Thank you, Johnette. Thank you for having me.
And I think I have to disclose that you and I used to be across the street neighbors, so we're kind of pals.
We already knew each other. Yes,
We've known each other well.
Long time.
But I haven't known a whole lot about your work. So why don't we get started by you just telling us what a radiation oncologist actually does?
Absolutely. So radiation oncology is the field, the specialty of medicine that treats cancer with radiation therapy. Our job is to figure out the way to kill tumors but protect healthy tissues using all the biology and physics training that we have to help be one of the three major arms of cancer care.
So when you talk about treating cancer, what kinds of cancer do you treat, and how many different types of cancer are there?
Well, there's several dozen different types of cancer, and radiation therapy is actually used to treat almost all of them. Radiation has been around for 110 years. It's been, one of the least toxic and one of the best tolerated therapies, and actually one of the most curative therapies. So just about every type of cancer needs radiation therapy.
Now, we often hear about, you mentioned chemotherapy. Why do people have radiation therapy, and why do some people have chemotherapy? And some people actually have both, don't they?
They do. So the three major arms: surgery, chemotherapy, and radiation therapy. Chemotherapy is given by vein, and the idea behind chemotherapy is that it can travel all around your body and treat hidden cancer cells that could be hiding somewhere else. Okay. Surgery and radiation therapy tend to be more localized therapies. Surgeons can only remove what they see with their naked eye, but with radiation therapy, you can treat an entire area, or you can use it definitively in lieu of surgery. And so it really depends. It's more powerful for treating local disease.
So I would imagine a cancer patient, when they come in, you've kind of got a team of doctors trying to figure out which of these things do we do and which one do we do first. Is that typically how it works?
Absolutely.
And then they say, all right, we want you to do radiation. We're going to go send you to Dr. Rosen.
Exactly. Cancer care is very multidisciplinary. And so, we, as all the specialties, will get together, discuss patients, figure out the best way to treat them. As a radiation oncologist, our job is to sort of use the literature to help drive the best way to treat a patient. And we're very literature driven, meaning we look at the medical literature and see in which cases radiation can either palliate symptoms, cure patients, or prolong life.
So what kinds of cancer is radiation most effective for?
Wow, well, that's a general question. I'll tell you, radiation therapy is very effective for almost all cancers. It's an equal standard of care for prostate cancer. It's used frequently in lung cancer, head and neck cancer. I treat a very large portion of breast patients and gynecologic malignancies, all which typically require radiation therapy, brain tumors, spine tumors. Honestly, radiation therapy is used in almost every, 60% of people with cancer will get radiation therapy at one point in their course.
Oh, wow. So you do stay busy. And by the way, I always like to tell our viewers where our guests are located, because of course we have viewers in Texas and Arkansas and Oklahoma. So why don't we go ahead right now and make sure everybody knows where they can find you? Absolutely.
So I'm at the Willis Knighton Cancer Center, and that's on 2600 Kings Highway. Willis Knighton's Cancer Center has two buildings. We have the Oncology building and the Proton Center next to it, which of course we're going to discuss today. It's on the corner of Kings Highway and Hearn Avenue. We have a 5-man practice and then another 8 medical oncologists and a gynecologic oncologist in the same building.
Oh, wow. So you all are a big practice, which of course you need to be, because you do something that's really special and that it's kind of amazing we have it in Shreveport, quite frankly, right? It's proton therapy, because we're not as big a city as you
Right.
think we need to be with so few proton therapy centers. So why don't you tell us a little bit about proton therapy and how it works?
Absolutely. Well, first off, you're right. If you were in New Orleans or San Antonio or San Francisco, there is no proton therapy available. Louisiana, this was kind of a special thing for Shreveport because we were the 14th proton center in the United States, and we were really pioneers because the proton therapy center at Willis Knighton was actually the first one in the entire world that was compact and that used a special type of scanning technology that allowed it to be much more accurate and that was image guided. So before Willis Knighton's program, the proton therapy units would occupy a football field size, whereas ours fits in a tennis court. And so really compact image guided proton therapy has completely changed the way proton therapy is given all over the country. We were able to start that because of a leadership position that we've had in radiation therapy for the last 20 plus years. And having a good, strong physics team, partners willing to invest the training and effort, the staff we have and support of our administration has allowed us to do that.
Now, having known you for a long time, I have a feeling that you were the driver of this initiative.
I certainly came back with the idea that because we had led the nation, really, we were very, very early implementers of some of the more advanced radiation techniques like intensity modulated radiation therapy and image guided radiation therapy. To me, it was important we stay on that cutting edge, and so we started looking at this at around 2008, and by 2014 we treated our first patient. So yeah, I suppose, but it's definitely not something you can do without a tremendous team. Proton therapy should be limited to those practices that have a real expertise in radiation therapy and physics.
So how many of your partners can do proton therapy? How many of you are
certified?
Certified, yes.
So all 5 of the radiation oncologists at Willis Knighton are able to do proton therapy. And we're the only ones in the state. As you can imagine, we get referrals from all over the state and in fact all over the country and even the world. I mean, we've received referrals from as far away as Brazil and all over Europe. So it's been a real experience.
So you have people coming from all over the world here to see you for this particular therapy.
It's been a real, for somebody who's from Shreveport, it's been something that really makes me feel good for our community because, we hosted the world's largest proton therapy users meeting in Shreveport. So we had people here from 5 continents and over 20 countries, from Russia, from India, from China. We've lectured all over the world on proton therapy, and because we were the first to have that compact image guided system, a lot of the diseases that are treated by proton therapy now were really pioneered in our department. So
that's amazing.
It's exciting for our community, and it's really a nice thing for our patients.
So tell us why you thought you needed to bring proton therapy here, because clearly we had something before that.
Sure.
And why is proton therapy better?
Okay.
And what's the difference in the outcome? So, yeah.
So first off, radiation therapy in general is historically been very successful in treating cancer. If you actually look at the number of cancers treated, it can cure more cancers than any other. If you look at the screen, there's a graphic that shows why proton therapy has an advantage over more traditional radiation. If you look at the green line on the screen, you'll see that's an X-ray beam or traditional radiation that deposits most of its energy very close to the surface, and it actually gets weaker as you move deep into a patient where a tumor is located. The red beam that you can see, you notice that it enters at a much lower energy, and then it has that peak called the Bragg peak, where it deposits all of its cancer-killing energy right on a tumor, and then that particle is annihilated. So there's no exit dose to the patient. So proton therapy actually gives 1/3 of the amount of radiation therapy to a patient as the radiation that's given in the other 8,000 radiation units around the country. Proton therapy is also reporting some of the best results in certain areas. For example, and I think that graphic you could take down, for proton therapy, for children, it is the standard of care. And the reason is children are, of course, very sensitive to therapies, medicines, chemotherapy, radiation therapy, because they can develop growth abnormalities or second cancers or other problems as they get older. So by using proton therapy and reducing the amount of radiation, it is the standard of care. In other areas, it is also such as chondrosarcomas and tumors that involve the brain and spine is the standard of care. And for prostate cancer, you have some of the best reported results compared to surgery or conventional radiation therapy or any focal type therapies that's ever been reported.
So proton therapy is actually more effective at attacking the cancer and minimizing or eliminating it than other forms of radiation.
So by definition, proton therapy is more biologically powerful than traditional what we call photon or X-ray radiation therapy. I'm not prepared to say that the cure rates for cancers are always better with proton therapy. Clearly, if you can reduce the side effects of treatment, though, you allow for a higher dose of radiation therapy. It allows you the opportunity to give better systemic treatments like chemotherapy, biologic therapy, hormonal therapy. So when you combine the two, it could potentially result in much better outcomes.
So let's talk about radiation generally.
Okay.
I think about when I'll go in for something and they'll put this big old heavy metal thing on you to protect you. It's, when you were just getting a test run. I mean, radiation, you don't want a lot of it. Is that correct? Any more than you need to attack a cancer?
So radiation therapy is the kind of radiation therapy we use for cancer is on the order of millions of magnitudes stronger than the kind of x-rays that you're used to getting when you go get a dental x-ray, for example, or a chest x-ray. But the radiation is delivered extremely precisely, even with conventional radiation therapy, which still, almost 3/4 of our patients are better candidates for more conventional radiation therapy. But if you can aim that radiation very carefully, the side effects of it are very mild. It still is the most tolerated form of cancer therapy that exists. That's why for so many diseases, it's become, for example, in breast cancer, to keep a woman's breast by removing a tumor and irradiating the breast is the common standard of care, whereas mastectomy 30 and 40 years ago was much more common. For prostate cancer, almost half of the men in the country are having definitive radiation therapy rather than observation or surgery or hormonal therapy or other treatments. So radiation therapy for brain tumors and head and neck cancers and it's gynecologic malignancies is really the standard of care in many, many cases.
All right, well, it appears we already have a caller. John, welcome to the show. And what is your question for Dr. Rosen?
My question for Dr. Rosen is that there have been studies been done on the effect of the proton surgeries concerning the prostate cancer, damage to the other organs around that site. Then studies been done on that.
So if we could put that last graphic back up for a second, I actually will show you a picture. You can actually see the difference between traditional radiation therapy on the left and proton therapy on the right. What you're looking at there is the bowel sitting in front of the sacrum or the tailbone, and that large area to the right, that circular area, is the bladder. And you can actually see that proton therapy gives almost no dose to the front. It gives no dose to the front of the bladder and no dose to the back of the rectum. And because of that, there is a study from the University of Florida, published by Dr. Nancy Mendenhall, that demonstrated PSA control rates for prostate cancer that were 5 to 7% better than any that had ever been reported for intermediate risk prostate cancer compared to surgery or traditional radiation. And intermediate risk are those patients that men often receive therapy.
Okay, do you have another question for us?
Yes, the other question was that there have been cases that well, I was trying. The question would be, what type of protection would there be against the rectum, radiation getting to the rectum or the bladder? There any other protections for that?
Yes, sir. It's a great question. So the first thing is that just by using protons itself, you're giving much less dose to the surrounding organs. But we also use tiny, what we call fiducial markers to help triangulate the prostate. That allows us to aim more carefully. And there's a technique where we insert a hydrogel between the rectum and the prostate, which separates those two organs. And that allows us to give even less dose to the healthy organs. And that has resulted in a dramatic reduction in what is already a very, very tolerable side effect profile.
Okay. That was a good answer, wasn't it?
Yes, it was a good answer, but what's the success rate with the gel?
It reduces the gel reduces the risk of, for example, passing blood in the rectum down the road from about 12 to 15% long term down to about 5%. So it's actually very successful.
Okay, so how long has the gel been in effect for use?
The gel has been around for several years. We've been using it at Willis Knighton for a few years, and the gel is actually absorbed by the body, so it goes away a few years later. 6 months later.
The next question would be, how long does the gel remain in the body?
About 6 months, yes, sir, and then it's
About
absorbed by the body.
Okay. There's one other question in relation to this. In the studies that have been done, what's the normal recurrence of the prostate cancer after proton treatment? Is there signs of recurrence?
So it really depends on the stage of disease at presentation. So let's just say a typical prostate patient with intermediate risk disease who receives therapy, PSA control rates, which is how we measure cure based on your PSA blood test, would be in the neighborhood of about 85 to 90%. And that's the same as surgery and radiation in its many forms. The proton therapy data that I mentioned from the University of Florida for intermediate risk disease was actually published at 94% at 5 years. So that's the best that's been reported.
Okay.
Thank you.
Well, thank you. I believe that answers quite a few questions right there.
Thank you for your
Those were good questions too. Very specific. And side effects. What are some of the more common side effects with proton therapy as well as traditional
So
radiation?
when you start talking about side effects of radiation, remember it's a local therapy. It's delivered to where the target is. So if you're treating a lung cancer, the side effects may be in the lung. If you're treating the prostate, the side effects are related to bowel and bladder. On your screen, you'll see an example of why side effects are reduced with proton therapy. Traditional radiation, I mentioned that you have an exit beam. So let's say you're treating a tumor behind the eye, which is what you can see on this graphic. And you can see the exit dose passing through the brain. So side effects there may be fatigue or possibly some impact on headaches or memory loss, even affecting the hearing because of the ear nearby. Whereas on the right, you can see proton therapy gives no dose to any of those other structures. So the side effects of proton therapy are related to the area you're treating and the structures that sit near them.
So in your practice, have you all kind of carved out your Dr. So-and-so typically does these, Dr. So-and-so typically does these, so that you all do all of you do all of them?
That's really a great question, and that's one of the things that really separates our department from most of the other departments in the state and certainly in the city, is that we have 5 partners in our practice and we all subspecialize. All of us, for example, treat prostate cancer and a few other diseases, but for example, I treat all of the gynecologic malignancies or most of them. My partner, Dr. Katz, treats most of the head and neck cancers. Dr. Jake Wong treats most of the CNS tumors, central nervous system, brain and spine tumors. Dr. Dursey treats many of the gastrointestinal diseases. Dr. Jaramillo treats many of the lung cancers. So we all subspecialize, and each of us attends specialized tumor boards for those diseases. And when you have a lot of experience treating something, as I spoke about a month ago on cervical cancer, and our results are about 10% better than the state average. And we like to think that's because of experience and the team's experience, because we really have a very strong team in the department.
Yeah, one of the things I think we've all heard is if you need a procedure done, look for someone who's done it a handful. You don't want to be patient number one or patient number two. Is that part of the advantage of really specializing, is ensuring that you all have all done these, what you do in particular, over and over and over again?
Absolutely. I mean, speaking specifically to proton therapy, because that is a procedure, we have been doing proton therapy at Willis Knighton for almost 9 years. I mean, that was 5 years before Johns Hopkins or Memorial Sloan Kettering. It was before St. Jude's or the Mayo Clinic. And over those years, we have learned how to develop the techniques to deliver that treatment appropriately. Our physics and dosimetry team have won national awards. We actually even received in 2019 something called the George Starksel Award, where we were awarded that award by the American Association of Medical Physicists, or Physicists in Medicine. And it was for the best medical physics journal article in the entire United States. And that was out of thousands of submissions. So, to do what we do requires, it's not like a typical radiation therapy department. And I'm a fan of radiation therapy for many diseases, and especially when used with surgery and chemotherapy. The three of us work together very carefully. But we do offer something very unique at Willis Knighton.
So if you were among the first, who trained you?
So that's a
Who
great.
trains the first guy?
Right, so that's a great question. So our staff, and this is one of the things that we taught other departments, we sent our physicians and physicists and dosimetrists and therapists all over the world, to Germany, to the University of Pennsylvania, to Switzerland. All of us attended courses and spent weeks training. We then brought the University of Pennsylvania team to Shreveport. And actually, so our relationship with the University of Pennsylvania, which is one of the top cancer centers in the world, UPenn is the national training site for IBA, the company that makes proton therapy, the big football size units. Many of the sites that use the Proteus One, our machine, actually train in Shreveport. So for example, the entire country of Spain, in Madrid, the Spanish Proton Center came to Shreveport to train. The dosimetry team at the Huntsman Cancer Institute in Utah came to Shreveport. The Chicago Proton facility sent their team here to sort of monitor the way we treat things. So the United Kingdom, 3 of the sites in Great Britain trained in Shreveport. So we took what we learned from the few sites that existed. We got help from the University of Florida. Their physics team was very helpful. There were only 6 sites in the United States when we started planning for proton therapy.
I would imagine that purchasing Proteus, doing all the training, that was a sizable financial investment.
It really was. I mean, proton therapy is an expensive technology. Willis Knighton, I was so pleased that the administration put our patients' priority at number one, and we were never questioned in the cost of the technology to bring it here. Even though you have to have specialized equipment. We have a dedicated MRI scan, a dedicated CAT scan, 2 dedicated CAT scans in fact, and a PET CT scan, all right in our department, that are used for making proton therapy better. So it's a financial commitment, but it results in better outcomes for patients, and it continues to let Willis Knighton be a national and international leader in radiation
well, no,
therapy.
it's one of the things Willis Knighton is super proud of, the work that you all have done. I mean, you're at the top of the list.
We're very proud of it. It's been a lifelong accomplishment. You can actually see, this is the Proteus One on the screen, and you notice that this has the nice purple color in the background. We actually were the first site in the world to have something called the ambient experience for a proton unit. We actually traveled to Amsterdam and then went to Belgium and negotiated for IBA and Philips, who were a training partner with. Philips provides some of our equipment. And together we put this technology in the room that allows patients to feel comfortable. They can watch videos, they can listen to music and have their own colors. And you can actually see in the bottom left corner, this machine won the world's 2 best design awards when it was created.
Wow, and where was it created?
The machine is built in Belgium.
Belgium, okay.
It's a Belgian machine, and we have several Belgian engineers based full-time at Willis Knighton to help us with this.
You know, I'm sitting here right now imagining, I know you're publishing and you are reading all the research related to what you do. You're treating patients, and you got guys and gals from all over the world coming to Shreveport wanting to be trained by you. How do you balance all that? I bet you stay like really, really busy.
It's a very busy department. We're one of the busier departments, if not the busiest department in the state. But we have a team alignment mentality. It doesn't matter from our administrative staff to our nurses, our physician assistants, our therapists, our physicists, dosimetrists, our students, housekeeping. Everybody in our department is aligned in wanting to have the best outcomes we can for patients. And it's very mission oriented. So yes, we are busy, and but
your kids are grown.
The kids are grown. My son is actually going into radiation oncology, which made me very proud. My son and daughter. My son is in dental school, my other son, and my daughter hopes to go to dental school as well. So we have time at home.
Yes, you do have a little bit of time. So please tell all of our viewers where they can reach you, find you to learn more about all of this, because we want to be sure that they know how to call you and where your website is and all that good stuff.
Very good. So if you ever needed to, you can always contact just the Willis Knighton Cancer Center. But our office can be reached at 318-212-4639. 318-212-4639. That's the Department of Radiation Oncology. And we are very comfortable accepting second opinions. In fact, for example, I mentioned prostate cancer a couple of times. Our prostate cancer patients, almost half of them present upon self-referral from other facilities. And we're very comfortable accepting other opinions. Usually a medical oncologist, a surgeon, a gynecologic oncologist can refer. Proton therapy is, of course, only one of the several things we do. And so we try to take what is a very large armamentarium of weapons to fight cancer and pick the best one for a patient. So we don't just do a treatment because someone asked for it. We do what's best for the patient. So we're very easy to reach.
And since proton therapy is so new, is it covered typically by health insurance?
That's a great question. So for example, it's not experimental. Proton therapy has been around. They've been treating children at Harvard since the 1980s. Medicare pays for it. A few local insurance carriers pay for it. And we can usually negotiate and try to appeal to the insurance companies that don't.
And is a referral needed to come see you? Because I would imagine that you're not a first stop.
Oh, we frequently are the
Really?
first stop. Yes, we are frequently the first stop for many cancers, but we prefer if you don't have to have a referral to come see us, especially for second opinions, but typically the way it will work in radiation oncology is a patient will be referred to us by one of our colleagues in medicine, even not the cancer colleagues, urologists, pulmonologists, head and neck physicians, gynecologists. So referrals are common, but not necessary all the time.
And how many procedures do you do a week?
Oh, wow. Well, we're treating anywhere from 60 to 100 patients a day.
Goodness!
On proton therapy, it may be somewhere more like 20 patients a day. And then we also have a very large, what's called a brachytherapy practice. We were a national training site for brachytherapy, which we do, for example, in cervical cancer and skin cancers and uterine cancers. And we do about 2 of those a day as well, and are on the National Astro website. The videos were filmed in our department. So we're a busy department.
It sounds like you are. This has been so fascinating learning about proton therapy. It's such a great treat for me to catch up with you. And you're a rock star, Dr. Rosen. That's all I've got to say.
So are you, and I appreciate you having us so much. And again, it's a team effort.
All right. Thank you for joining us for Healthline 3. We hope you have a good day.